Hello and welcome to today's Facebook Live with Floyd Medical Center. I'm Dan Bevels, Public Relations Manager for Floyd, and we're happy to join you again this afternoon to provide you some information on where we are as we combat the pandemic known as COVID-19. We're going to spend the next 15-20 minutes or so updating you on current conditions at Floyd, talking about some new initiatives that we have planned for you, and just providing a general update. Now, we're doing this every Wednesday afternoon at 3 o'clock, so we encourage you to join us each week for the latest up-to-date information from Floyd. We want to do everything we can to be transparent and make sure we're addressing the concerns of the community, and we feel like this Facebook Live venue is a good way to do that. So thanks for joining us today, and we look forward to talking to you each week in this format. I do want to remind you before we get started that Floyd.org is a great location for you to get the latest information about Floyd on a daily basis. So go to Floyd.org, and there on the homepage you'll see a link to COVID-19 information for Floyd Medical Center. So we encourage you to do that throughout the week between these Facebook Live sessions. I want to introduce my guest for you today. Again, joining us this afternoon is Kurt Stuenkel, Floyd President and Chief Executive Officer. To his left, we have Dr. Robert Holcombe. Dr. Holcombe is a physician at Floyd Urgent Care in Rome, and I look forward to providing some great information for you. And then also joining us is David Early. David is the Vice President of Support Services and Operations here at Floyd. And David's going to talk about some plans we have just in preparation of what could happen in relationship to COVID-19. But Kurt, I would love to start with you, first of all, as we begin this session, just to provide an update on where we are currently at Floyd, if you don't mind.
Well, thank you, Dan, and it's good to be with everyone today that's in the listening audience. It's been a week since the last time we gathered together, and we're happy to be here again to share the latest information. I heard someone describe, every day that we've been going through since early March as another scene from the movie Groundhog Day, and I think there's a lot of truth in that. I mean, we go to bed listening to all the news reports, and I know a lot of people probably like me. I'm looking at my news feeds as well, just trying to keep up with all of the information as it comes available to us, and then wake up the next morning and we do it again. We're faced with a similar reality. But while it does kind of seem like Groundhog Day every day, there are also things that are rapidly changing all around us. And there are things that are rapidly changing here at Floyd as we are preparing our response for what is being predicted. Now, we're not experts here at Floyd in modeling or predicting. We are looking, just like everybody else is, the rest of the country, as to what might happen. We're using models that others are using. We're using the model out of the University of Washington, also the models that are being used by the state of Georgia. And these different models all predict different things. As Dr. Anthony Fauci has said, he has said that the models are only as good as the information and the assumptions that you have. And so we are looking at all these models to plan as best as we can. State of Georgia is using a model that is out of the University of Washington that indicates that sometime later on in April that a surge will hit Georgia. That may be correct. We are getting prepared for that, and I'll say a few things about how we're getting prepared, and so will David Early as he talks about some of the physical plant things that we're doing. Our own trend line, however, in looking at our day-to-day number of patients that we have here at Floyd Medical Center, what we call PUIs, persons under investigation. That means it's a patient that's showing signs and symptoms, but we don't have a test result back. So we take care of that patient under the assumption that they have COVID-19. So we have PUIs, and then we also have positive people that have tested positive for COVID-19. And our daily numbers, as we've started, there's been a little bit of variation, but generally it's been about a 6% growth rate. So as we trend out that growth rate, again, based on some assumptions, we show a trend based upon our own internal data that's going to show things going up later on into May and perhaps even June. Now, we don't know, and also as Dr. Fauci has said, the data is what will actually tell us what's going on, so we're really relying on the data to see how the data on a regular basis informs our planning. But again, as I said, if it happens in April that the numbers go up, swiftly, we think we'll be ready for that. And the ways we're getting ready is we are planning to use every nook and cranny that we've got here in the hospital. And we think we can grow up to 299 places to put people, and maybe even a little bit more here at Floyd proper. Now, some folks that are up on the statistics will say, well, we thought Floyd had 304 beds. And that's true, we're licensed for that. But we have 53 of those beds over at our behavioral health facility. So you got to take that away from the 304, and then we're going to be able to surge some more. We also take out in our calculation our maternity and labor and delivery areas, because while this COVID-19 crisis is going on, mamas are still delivering babies, and we want to be able to take care of those folks in a COVID-free environment, and we are, and we will be able to do that. And so we plan, subtracting out those numbers, to have around 299 or 300 places to put people here at Floyd. And then as it grows beyond that, we have surge capacity that we're currently constructing right outside the hospital in 2 locations. And I'll let David Early describe that in a second. But it's not just the physical facilities. We've also got to plan for supplies. We have to plan for equipment, and we have to plan for personnel. And we have work groups that are working on all of those things, because as we surge up, and we hope we don't surge precipitously, we hope that all of the social distancing that we're practicing actually works to flatten out the curve. But as the numbers go up, we've got to match those numbers with personnel, supplies, and it's not just having beds to put people, it's having everything we need to take care of them. And so we're planning on that, and we work on that on a daily basis. And in fact, we have 3 times a day that we gather together as a management group to talk about what we have in process, what we're working on, anything that might have occurred, a new idea, a new thought. We meet first thing in the morning at 7:30 by teleconference. A few of us will gather physically in a room, all socially distancing, but then most of the folks are calling in. We gather again at 11 o'clock for work team reports on what they're working on, and then we gather again at 4 in the afternoon to see if there are any other things that we need to talk about as the day is drawing to a close on first shift, and then we do it all over again the next day. And that rhythm has helped keep us on track and keep our team working and energized as we aim towards being ready for what might be out there.
Kurt, just before we transition to David, I think that it's important to always reiterate that this is, while this particular situation is new to Floyd, our preparation is not. That's something that we do year-round, all year long, from safety huddles to everything else we do is in anticipation of something like this happening and what we can do to be responsive.
Well, that's right. In fact, we talked about that a little bit last week. We are a regional coordinating hospital, and for our multi-county region in Northwest and West Georgia, we coordinate regional drills that practice various types of disaster scenarios to make sure that all the resources are there. And that practice that we've done creates a mindset in us as the regional coordinating hospital, but also in all the other hospitals that participate with us. How do you think through how to be ready? And it's the physical facilities, it's the supply, it's the equipment, it's the personnel. How are you going to take care of them? How are you going to triage them? And that kind of ongoing drilling, training, preparation, I think really serves us well and helps us to know how to think about this unprecedented environment that we're in. But it is really impressive to me how well everybody at Floyd is thinking through all of these issues. And at hospitals throughout the nation, the whole healthcare system is doing an amazing job in responding to this crisis that's occurring in every place in the United States, every place in the world. And hospitals are one of the cornerstones of every single community. And I just can't say enough as our leadership that I experience here, our line workers, but you'll see it in every community in the United States.
David, let's talk a little bit about the prep work we're doing for that surge. Kurt talked a little bit about what's going on in our parking lot. Can you expand on that a little bit and just give our folks watching an idea of, hope's not a plan, but what we're doing just in case things take a turn?
Certainly. Thank you, Dan. As Kurt mentioned, we have work teams that are looking at models that predict when does the apex happen for COVID-19. And certainly, we are looking at the models that say this is the closest date and this one's further out, but we have to plan for the worst situation that we can, and that's what we're doing. The whole team has been very proactive. We started out preparing the northeast building, we call it, it's the old Kindred building, 27 beds on the 3rd floor. Quickly brought that on into our lineup, 27 beds. And then as that came on operation, we looked at the 2nd floor. And so just to give you an idea, throughout the hospital, there's a team working to see how can we utilize our interior space. That's going on. But we're looking at some of the apex, the super surge we've called it. How can we handle that? This is where we go above the 299 beds. This is where we may need 500, 520. So the site of the 20, we have a 20-bed hospital that's going to be out front in the parking lot, and it's going to be a 20-bed ICU. It can handle up to that acuity. That's coming. It's coming through GEMA, and it's going to be here April 20th and come on operation. Our plan is April 27th. But on top of that, we also have looked at models that pushes the super surge further. So we are working on the 1st floor of the 2-story parking deck, and this can handle up to 200 patients. And the team is working very hard with that. Some of the local contractors that we have that we're blessed with is Parker Systems, LLC. They've served hurricane relief ever since Katrina. Every hurricane that has come to America on the East Coast, they have serviced, and we're using them to help us to quickly come up to speed. We're also using Brassfield and Gorey and many other local contractors. So it's a team effort. We believe that what we're doing, we call it P1. It's the 1st story of the parking deck on 2-story. We believe by April 18th or 20th, we're going to have this somewhat operational to service up to 200 patients if the surge is needed. We hope that we prepare this, both the 20-bed hospital and the 200-bed area. We hope that we never use this. Certainly we are going to serve the community and make sure that we're ready for it. And that's our mission here at Floyd Health System. We're here to serve the community. And as Dan mentioned, we drill, we practice. Well, this isn't a drill. This is the real thing. And our team is responding. We appreciate all the support through the community has given us.
I realize some folks that are listening, and I think there was a Rome News Tribune story today, came out online, they may be saying, a hospital unit in a parking deck? Actually, it's a great idea. I mean, it's got a concrete superstructure, it's got a rooftop covering, it's got a concrete flooring, and now we're standing up walls and bringing in through Parker Systems, and also just constructing things, HVAC, electrical, lighting. It's going to be a really fine field hospital. You know, out in Central Park, this story is now 2-3 weeks old. I mean, they put tents, field tents in Central Park. Well, we're putting it in a parking deck because we've already got a structure and we can put in walls and make it work. It's really a great idea.
Yeah, and just to follow up with Kurt, this is going to be a very nice place for our patients. You know, a lot of health systems are putting up tents, many other things, but the space that we're building, we've painted the ceiling, we've cleaned the floors, we're putting in walls, we're drying the space, HVAC, and all the other things that you would want in a clinical setting. And I think the team is going to be very proud to present this to our team members. And also, if we have to serve our community, it will be ready.
Well, one of the other options, just quite frankly, was to go across the river and use the Forum downtown. Mm-hmm. And we thought about that as an option, but this is proximate right near the hospital to where we can have the utilization and the ease of getting back and forth to use the hospital infrastructure as opposed to being across the bridge, across the river, you know, a mile or so away, you know, by the time you got over there. And this was actually just a much better option.
We do want to point out that that's the part when we talk about a parking deck. It's not the parking deck that's across from the hospital on Terminal. It's actually the one that is on our main campus by the main entrance. If you pull in there by the Floyd sign, it's the parking deck that's to the right of the sign there. So when we talk about a parking deck, that's That's where we're talking about, where this temporary facility is going to be housed. Dr. Holcombe, I'd love to bring you in on the conversation for a moment, because we talk a lot about the prep work we've done at the hospital and the steps that we're taking to combat this, but your folks, yourself and others, are on the front lines as well in our urgent care facilities. Can you talk a little bit about the process at our urgent care and just encourage folks that we're still open, we're still seeing folks, we're still taking care of people?
Absolutely. Thank you, Dan. Well, as David and Kurt both have alluded to, we're here to serve our community. And at Urgent Care, we've been serving the community since 1994, and we're still here. And it's a scary time. I realize people are really anxious. Should I go in or not? Well, am I going to be exposed to this? As a matter of fact, I even had a phone call on the way over here from a patient asking about, I have a bad infection. Is it going to be safe for me to come in? And I assured her that it is, because we're set up at urgent care. When you approach, there's a sign, and it states if you have symptoms such as shortness of breath, cough, fever, aches, stop. Go back to your car and call this number. And that line goes directly to the nurses' station at urgent care. One of the nurses will pick up, talk with you, triage you, go over your symptoms, and if they have a question, usually one of the providers will be there at the nurses' station and they can ask us the question. We make the determination then if you're someone that needs to be put in isolation, and if so, we have you register in your car, and then you are brought around to the side of the building where you are met by a nurse in full PPE, and you're brought into the building to an isolation room. So you are never exposed to the remainder of the staff or other patients. If you're someone that has an ankle injury, you can feel safe. You can come in. You actually, if you get past that sign, a screener is just inside, and that person will stop you and make sure why you have actually come past the sign. And will ask what your symptoms are, what your problems are. It's a sprained ankle. She'll direct you over to our well waiting room, because we actually have two separate waiting rooms in the urgent care. One for the well patients, our injured patients, their traumas, our folks that are there for company physicals, our workers' comp. Those will go into the well waiting room. Other folks that are sick, that may have allergies or a stomach bug, they're put over into the sick waiting room. They again are separated. So we try to take those precautions to protect our community, our patients, as well as our staff.
And Dr. Holcombe, I just want to reiterate one more time. I know you touched on it, but we hear questions from time to time. We're open. We're there taking care of folks. That never changes. We're right there for you, right?
Absolutely. We are there. As I said, we have been there before, and we're still there. We're ready to take care of you if it's concern over the COVID infection, or if it's your allergies or injuries. We're present.
Well, we appreciate all of you are doing. Kurt?
And I'd like to point out, we're talking about Floyd's preparation for COVID-19 patients that are urgent care centers, and we have several of them in the multi-county region. We actually have tested more people for COVID-19 in our urgent care centers than in any other site. Mm-hmm. And so if you are not feeling well, this is a place that you can come, and it's shown out in the numbers.
And Dr. Holcombe, we should point out that those folks that are coming in to the urgent cares, not all of them require hospitalization, correct? Could you talk about that just a bit? Some are able to be self-quarantined at home?
Absolutely. As a matter of fact, the majority of the ones that we have seen are able to be checked out, tested, and then sent home for self-quarantine. They don't require the hospitalization. But if there is an event that someone is quite severe, we can arrange for them to be sent over to the hospital.
Well, we're running pretty short on time. David, just really quickly, we received our first batch of PPE from Heritage Sleep Concepts this week, and that's encouraging. I mean, as we've said all along, we have been in good shape regarding PPE, but it's nice to have that support from a local business.
Yeah, certainly. Again, we're using a local company, Heritage, as you mentioned. We're looking for the future. We're trying to plan. We have a good stock of PPE, but we know that if this thing runs more than we're thinking, several months, we may need a mass supplier, and Heritage certainly, they stepped up to help us. And it's been an exploratory type adventure. We certainly have gone into this, and we've had many prototypes of masks, and we've talked to other health systems on what they're doing. And so we believe that we have a good system to provide us some masks locally, and we hope it doesn't come to that point. We certainly have developed a resource which we can draw from, and we're going to utilize that.
Well, we're very close to being out of time, but quickly, we launched telemedicine this week for our primary care locations. We're very excited to make that available. It launched earlier this week, and Kurt, we're rolling that out on a somewhat limited basis. We're not able to see every particular condition, or maybe Dr. Holcombe, you want to touch on this, but we're doing what we can to help patients in that way, and we're thrilled to see where that's going to be able to take us over the next few weeks, wouldn't you say?
Absolutely. Well, telemedicine is a very good option in this time of year, but of course, as we have to understand, there are only certain situations in which it does apply. If you have someone, as an example, that is a chronic patient and you are changing, say, their pain medication, you will bring them back in a few weeks to see how they are responding to that. Well, telemedicine is a perfect way to do this, to make contact with them, especially with elderly cancer patients, and to see how they're doing. Now, would that work with somebody with blood pressure or cholesterol? Not really, because in those you need to actually see them and take care of them. Another situation would be somebody that's having anxiety or depression related to all the activities going on right now. Perfect. Be able to have the telemedicine conference and talk with them. I think that'll be a very, very good alternative.
We certainly believe so. And if you're interested in determining whether or not you're eligible for that virtual visit, we encourage you to call your primary care provider and talk to them about what might be available. We certainly want to do that for you if we're at all able to, but we also do want to say that we are still seeing patients in our primary care locations. So if your physician determines that your particular situation isn't best suited for a virtual visit, then by all means we'll make an appointment for you to come in and receive treatment there in the office. But certainly call your physician, because it's possible that we'll be able to do that for you in a very safe environment. You can do that from the comfort of your own home or from your office, whichever is easiest for you. But we certainly want to make that procedure available for you if we're able to, and we'll provide more information. As a matter of fact, I believe on next week's Facebook Live edition, we're going to talk a little more in detail about how that telemedicine is operating at Floyd and how you might be able to take advantage of it. So we'll have that for you coming up in the next few weeks. Gentlemen, thanks so much for joining us today and for, again, being so transparent with not only our employees but also the public about how we're addressing the situation. We appreciate it. And thank you for joining us. We encourage you to go to floyd.org/COVID-19. That's our webpage that we've set up specifically for this situation, floyd.org COVID-19. You'll find a wealth of information right there. And also stay tuned to Floyd's social media for updates like this in the coming weeks. And until next Wednesday, I'm Dan Bevels for Floyd Medical Center, and I just encourage you to be safe. Have a wonderful rest of your week, and we'll talk to you again next week. Thanks for joining us.